We all still have so many questions about COVID-19, so we invited our viewers to send in questions for our infectious disease doctor, Dr. Michael Gardam. Doctor, thanks again for agreeing to another Q&A rapid fire segment.
Yeah, happy to.
We're going to get right to it. Okay, Work Mom Life asks, would a full lockdown help right now?
Right now, we don't actually need a full lockdown because we've done very well with everything that we've done. So we're actually in very good shape. And so a full lockdown would create a lot of damage, even more damage to the province's economy and to people's work life. But in reality, we likely don't need it.
Okay. This other question came up a lot. Are there statistics about relapse cases of COVID-19 once recovered?
I haven't seen anything like that here in Canada yet. There were some early case reports that people were discussing from China. I think there was one case report from Japan as well. It certainly doesn't seem to be a very prevalent, common thing. It seems to be something that if people can get reinfected, it happens very rarely. And then the other part of that is sometimes people can be looking like they're doing better and then get sicker, but that's kind of what we see with other viral diseases as well sometimes. It sometimes happens.
Okay, I'm going to get to Teresa's question next because I think you're the perfect person to answer it. A SARS expert committee wrote a report back in 2003. Were any of the recommendations followed to prevent another virus outbreak in this country? I know you were on the front lines during SARS.
Yeah, many of the recommendations were followed. I mean, we have the Public Health Agency of Canada because of it. We have Public Health Ontario, the fact that we're using N95 respirators, the fact that there's many things in there that were followed. One of the ones that we kind of followed, but then it fell by the wayside, was the creation of a national stockpile and also provincial stockpiles. You know, we were doing that, and then over time, we weren't replacing the equipment there. So that's an area that is really frustrating for me because that's been identified for years that we need to have domestic suppliers of the kind of equipment that we use. So I'm hoping that, you know, this time we're going to get it right and we're never going to do that again.
Okay, I'm glad you answered that. I was wondering that as well. Andy has this question via Facebook. Where are all the bodies of the COVID-19 deceased going? Do you suggest cremation over burials?
There's no specific recommendation one way or the other, and we're not in a situation like you've seen in the media in Italy or in New York City where the morgues are overflowing and that sort of thing. I mean, our system has been able to handle the number of people who have died thus far from this. So we're not in a different situation from what we would normally see.
Marina's question was also asked by a bunch of other people, so I want to get to that. What's holding us back from the increased testing that we keep hearing needs to happen?
The million-dollar question. You know, I wish I had a great answer for that because I'm a little bit perplexed as well. I mean, one of the reasons we were held back is because the people who we were allowed to test, that list really hadn't changed until very recently. So now that the different groups of people we can test has been widened, I think we will start to see a lot more testing. But it took several days for that new guidance to come from the ministry.
Okay, Dr. Michael Gardam, thanks so much for your time.
Thanks for having me.